Currently, it is extremely difficult in the marketplace for consumers to have any idea of what a service costs and what the quality of that service by that provider has been. We dealt with this issue last year to some degree, and we made some headway as to what standard we would look to in this bill, and there's not total agreement on this, as I'm sure there's going to be opposition. But the National Quality Forum standard, which is the largest and most diverse group that meets to set the guidelines for these standards, along with the number of indicators that are provided by the NQF, is what is outlined in this bill. And there is also a provision there that calls for market cost to be included in healthcare transparency. Right now, when you are purchasing a television, a sofa, a car, a home, you have information at your disposal to find out what something cost and what the track record is for that product. In an industry where that encompasses 1/6 of our economy, that information simply isn't available. And in my opinion, this is one of the most critical areas. If we're ever going to bend that healthcare cost curve downward, people need to know the cost and quality. They have a right to know the cost and quality of their care. And this is a bill to move that effort forward in our state.
Thank you, Mr. Chairman, members of the committee. As Senator Schmitt said, my bill 917, it's the same as his, except it does not include the cost data. It's just the quality data that would be required to be collected and reported.
The cost element is much more difficult to go after, but it's worth pursuing because ultimately, if I know a Mercedes-Benz is the best car out there, but I don't know what it costs, that calculation is incomplete. And so we are trying to go that step further and determine and try to get into the marketplace for people to see what the cost of a service is. And that is a tough fight, but as I mentioned, I think it's a fight worth fighting.
I think this is a success for our company for two reasons. One is we're being very fair in our reimbursement, but two, and probably most important, we're transparent. And we're transparent to the provider, to the payer, and to the consumer of healthcare themselves, so that the consumer can see what's it actually costing a provider to render services, what kind of profit are they getting, and you know, how that's utilized as it relates to reimbursement. The last page on there just shows we've actually developed a consumer website where consumers can now go out and determine what are the actual charges and costs. So if you are having a procedure done, you can actually go in and find out hospitals within your area, what are the average charges that they're doing, and then what's it actually costing that hospital to render services. And it's been very successful for our clients going forward.
But really what this bill does, though, Senator, is it says that if you're going to use quality information like a lot of the health insurance companies are already doing, and I applaud them for their efforts for if you're going to do it, we want to have a standard so that we're comparing apples to apples. That's really what this legislation does.
Fair enough.